Hello, and welcome to Life Kingsbury Hospital Maternity Tour video. At Life Healthcare, we are passionate about our little patients and pride ourselves in creating a safe and caring birthing experience. To give you peace of mind, here's what you need to do in preparing for your hospital visit and what you can expect when you get here. Your first step is to complete the pre-admissions process. This should be done at between 25 to 30 weeks of your pregnancy and can be done in person at our pre-admissions clinic, where our friendly team will assist you to complete the necessary documents to streamline your admission. Pre-admissions can also be done electronically or telephonically, which will save you time on the day of admission and give you one less thing to be concerned about, so you can focus on your delivery. Our infection prevention protocols are aligned to international best practice and have been and always will remain in place long after the COVID-19 pandemic. Your safety is top priority. To limit the risk of infection in our facility, both you and your partner will be required to have a COVID test before your admission. Please discuss this with your obstetrician. To create a homely environment for your birthing experience, we encourage you to bring your own music, images, and other items to fulfill your birthing plan. It is important that during your pregnancy, you discuss your birthing plan with your obstetrician, especially if you are planning a vaginal birth after cesarean, also known as a VBAC. You should also discuss matters such as whether you would like a doula or a midwife present and understand our birthing photography and videography policy. To help you get started in caring for your little one, we provide a complimentary baby bag containing some sample baby products. However, we encourage you to bring the following items along with you. Necessities for mom: 2 to 3 sets of comfortable nightwear, preferably with open front for breastfeeding. 2 packets of maternity pads. 3 feeding bras. Personal toiletries. Necessities for baby: disposable nappies, sensitive wipes, 3 baby vests and grows, hypoallergenic baby toiletries. For a comprehensive list of items, email the hospital's marketing and communications coordinator. For your preparedness and peace of mind, we suggest packing your hospital bag at least 1 month before your due date, as your little one may well arrive before your due date. We highly recommend that you leave all valuables at home. Our Little Life Maternity Unit is access controlled to ensure your safety and the safety of your little one. The nurses' station is situated at the entrance, and here you will be welcomed by a member of our team. At some point, we may decide to perform a clinical assessment in the labour ward. This will include fetal monitoring to reassure you of your baby's well-being and establish your progress if you are in labour. If you are in early labour and feel comfortable, you may be given the option to return to the comfort of your home. We will advise you of the progression of labour signs to look out for and when to come back to the maternity unit. If you choose this option, we encourage you to keep in touch with us via telephone. If you have a caesarean section, you will be taken to the fully equipped maternity theatre, which comprises of the following medical team: your obstetrician for the delivery of your baby, an anesthesiologist to ensure you are comfortable before, during, and after the surgery, a paediatrician to ensure that your baby is in good health, and theatre-qualified staff. For your comfort and needs, our 23-bed unit offers various accommodation options from private, semi-private, and general ward. Private rooms are subject to availability and are an additional fee. You are welcome to discuss private room availability with our staff prior to admission. Please note that during the COVID-19 pandemic, visiting restrictions may be revised at any time. Please contact the unit prior to your admission to confirm visiting times. If your baby arrives prematurely or needs extra care, our 12-bed neonatal intensive care unit has the necessary equipment and specialized neonatal trained nurses to provide expert medical care and attention to the tiniest babies. Bonding with your baby is important, and we highly recommend skin-to-skin bonding immediately after birth and throughout the hospital stay, provided that you and your baby's condition allows this. All babies are given a sensor tag with identification, which will be checked throughout your stay. The benefits of breastfeeding are widely known, and if possible, we encourage breastfeeding your little one. For first-time moms or when latching is a struggle, our qualified nursing staff will discuss and demonstrate the various breastfeeding techniques. Should breastfeeding not be an option, your baby will receive bottle feeding as an adequate alternative. The formula your baby receives in hospital should be continued when returning home. In the event of bottle feeding, you will need to bring baby bottles with 2 teats as well as baby milk formula of your choice. Rooming in with your little one is encouraged. However, if for any reason you feel the need for your baby to be taken to the nursery, a staff member will assist you. For your convenience, we offer newborn immunizations on a weekly basis. Our staff will inform you of when this takes place and whether you will need to return to the hospital. To help keep a record of your baby's immunizations, we provide you with a Road to Health booklet upon discharge. Please remember to bring this booklet with you if returning after discharge for the immunization. You are legally required to register your baby with the Department of Home Affairs within 30 days of birth. For your convenience, Home Affairs is on site at the hospital weekly. Should they not be on site during your stay, you will need to return to the hospital after being discharged to complete the birth registration process. We know that caring for a little one can be daunting in the first few days. Our nurses are available to answer any questions you may have on your first couple of days at home with your newborn. Bathing techniques and other education are offered. Upon discharge, please ensure that you receive your prescription and collect all your medication. Should you have any medication-related questions, our nursing staff and pharmacists are on hand to assist. It is important to make an appointment with your obstetrician 6 weeks after giving birth. However, in some instances, the obstetrician may want to see you 7 days after normal delivery. The pediatrician may also require to see your newborn within 6 weeks. Please contact their consulting rooms for an appointment. We hope that you found this information useful. For more information, please feel free to contact the maternity unit or email the hospital's marketing and communications coordinator. We look forward to meeting you and welcoming you and your little life to the Little Life Maternity Unit.